Hey everyone, it is time for Tuesdays with Tina. It is Tuesday, July 23rd of 2024, and I'm starting something a little bit different. Normally, I do these live Tuesday discussions on social media. I'll stream on Instagram and Facebook at the same time. I'll have my computer set up with like Facebook and my cell phone set up with Instagram, and I do it that way. And I'm pouncing back and forth and then trying to upload it to YouTube for others to watch at a later date. So I'm changing things up a little bit, trying to simplify my life and bring this information to you. So uh, that is why it's a little bit different and why right now it's maybe a little bit quieter. So today, what we're going to start off with is talking about the VA, the Vazirani-Akinosi injection. Now, the reason why I wanted to bring this topic up for this Tuesdays with Tina session is because of my experience at RDH under one roof this last weekend. I had the privilege of speaking to like a room full, like 200 plus hygienists on local anesthesia and options and techniques that we use in the dental hygiene world. And one of the ones that I discussed was the Vazirani-Akinosi, but time didn't allow for me to pull up video on that particular injection. Showed lots of other injections, but I said, didn't have time to incorporate that one. And I had a lot of questions about it. So I figured I will use that time now to address some of the questions, show you a little something, and also let you know that the how-to video for that particular injection is also housed here on YouTube as well. And you can be able to view that. It is one that I have available and ready to view. So just wanted to share that with you. And I have to say, I'm pretty excited to be doing this on YouTube, hoping to be able to make this a little bit simpler. So Mr. Skull did not get to go with me to Denver for Under One Roof, but Mr. Skull will join me in New Orleans this weekend when I'm at the ADHA doing a interactive workshop on the IA and Galgates injection techniques, which I'm super excited about. So the VA. Now, the VA, the Vazirani-Akinosi, this particular injection is a relaxed mouth mandibular block. Right? So we have three main mandibular blocks. You can go back and watch one of the previous Tuesdays with Tina where I talked about all the different mandibular blocks and kind of highlighted them, but this one is truly dedicated to the VA. So this is a closed mouth relaxed technique. So when we have our patients do it, we're going to have them kind of be in a more relaxed state. Now, Mr. Skull, his jaw is a little dislocated. The reason why we might choose this particular injection is because like if a patient has limited opening, we might not be able to give a mandibular block like a true IA or a Galgates. So having an option available where they're a little more relaxed and closed. And the reasons why they wouldn't be able to open their mouth could be a variety. Maybe they have an infection where their jaw is just so sore or swollen that they can't open. I was talking to a colleague just the other day who was working with a patient who had a severe molar pain, and it was so swollen that he was unable to open his mouth. So she used the VA injection to provide anesthesia for him long term to get him until the next day when they could get him with an oral surgeon to take care of that tooth. You may choose to do the VA injection if you have a patient that is severely dental phobic, needle phobic. It is very innocuous. This injection does not go through any type of muscle. Remember with the Galgates and the IA, especially the IA, that medial pterygoid muscle, the partner to the masseter, just runs right on this, this inside portion, the medial portion of the mandible. So when we do an IA or Galgates, it's pretty easy to contact or maybe penetrate through that muscle. So with the VA, we are not doing that, which is quite lovely. So again, remember, this is going to take care of the entire quadrant of the mandibular arch on the side you injected. The other thing is it'll help get that buccal tissue as well. I've used this for my patients who have very large cheeks or a large tongue where it is just so, their tongue and their cheeks are just so large and so over the top, out of control, that you don't see that raphe. You can't really see what you're doing, right? So when you're using the closed mouth technique, that can be really helpful. So again, I'm just going to show you on the skull, but you can actually watch the how-to video in here on YouTube under the anesthesia techniques, I believe is what I called it. I should probably remember. I should probably remember what I call these. Hello, friends that have joined. I appreciate you seeing you here. So as a reminder, if we're doing this particular injection, you're going to have a long needle. Now, this is a demo needle. It is a short needle, but I'm using it just so you can see that option, okay? Now, what we're going to do is we're going to go right between the maxilla and the mandible. And we're actually up at the height of the maxilla when we do it. We're not going to be down low. We're going to be up nice and high. And we're parallel with that maxillary occlusal plane. So be thinking mucogingival junction of the maxilla, parallel with the maxillary occlusal plane, and we're going to actually go straight on back. Now, when we do that, I'm going to take Mr. Skull's mandible off. You guys, I had such a blast at RDH Under One Roof. It was so much fun. So much fun. When I speak, I put some dirty jokes in there because, friends, anesthesia is kind of dirty when you think about it, when we talk about like the shaft of the needle. Okay. So, all right. So pretend that we've got the skull resting on top. Now, remember, I said we're going to be, let me turn this way. We're going to be coming at a higher point of insertion near that maxilla of the mucogingival junction. So I took the top part of the skull off so you could see how does that align up with the mandible right there. So when we're doing a VA, we're coming parallel. So you can see we're still parallel with the maxillary occlusal plane at the height of the maxillary mucogingival junction. But as I come back, and we're aiming towards the ramus of the mandible, as I come back, look at the height that I'm at. I end up right here near the neck of the condyle. The VA deposit solution right between where we would traditionally deposit for the IA. There we go. Good. Okay, get my angle right here. Kind of everything's backwards in the camera. Okay, so traditional for the IA, the Gaugates is even higher up near the neck of the condyle, but the VA comes straight back and it kind of splits in between the two. Our patients don't, oftentimes are like, did you even do an injection? They don't necessarily feel it when you apply your topical there, and you'll see in that how-to video. So I encourage you to go watch that how-to video, and I'll see. I'm a YouTube novice, friend, still, as I'm still working on it. I'll try to see how I can incorporate that how-to video to play right after this, because I think it would be really beneficial to be able to see that. But when you do it, your patients, they're going to be like, I can't even feel that. I didn't even realize that you gave me an injection. It feels fairly similar to the patient, like a PSA injection is, right? Like a hot knife through butter, because there's so much room in that area. There's not a lot of musculature. There's not tendons. There's no ligaments that we're working with, that we're having to penetrate through. That it makes it very nice. Like I said, for our patients who have limited opening, whether it's due to swelling, for our patients who might be particularly dental phobic, needle phobic, this would be a great option for you. Also, I have clinicians and friends, and I have as well used this with my patients who have some processing, as we were saying, we're in like neurodivergence processing differences, especially those whom are on the autism spectrum, finding it very useful for those particular situations as well. So, oftentimes I get asked why this particular injection isn't taught more often. It is a little technique sensitive, right? Sometimes some clinicians may have to put a slight little bend in the needle. Don't want to do that if you don't have to. But it is something that can be a little more challenging to perfect. But once you get it, it will become probably one of your go-to injections. All right. So with that, friends, I'm going to end this week's live Tuesdays with Tina. I'm hopeful that this new format of just live streaming straight on YouTube is helpful, and then we can share it out. And please be sure to like and subscribe to my YouTube channel, so that way you get notified when I'm going live and you get to see some of those other extras. And also keep your eyes out open. My Hit Me With Your Best Shot chairside local anesthesia book is it's so close. I'm just finishing up a couple of more sentences and editing, moving pictures around, and then getting ready to get it published. So keep your eyes and ears open for that. So just remember, it's only subscribers that will get notified when I go live, and you'll be able to chat with me, ask your questions. So tell your friends to like and subscribe to this so that way they can get notified. And if they have questions live, or if you have questions live, you can type it in and I can answer them. Okay. And it's not just anesthesia, friends, either. Medical emergencies, head and neck anatomy, those three are my favorite jams. And keep your eyes open for me at ADHA next weekend. If you're there, come say hi. I'll be with Waterpick not long after that, doing a medical emergency CE course. And then with today's RDH, just a few weeks after that, doing a 5 shots for anesthesia success, talking a little bit more about some injections and injection techniques and anesthesia. So thank you. Thank you for being here. Thank you for supporting. And I'm excited for trying this out different. You guys, I've been doing Tuesdays with Tina for over 4 years. And I'm finally looking at how I can streamline to make it a little bit easier. So until then, I'll see you next week, and keep hitting your best shot. Cheers. Bye.